Hello friends, today we are going to mark care plans that have been done on real patients. So these are samples to expose you to how the marking is done. If you understand how it is marked or why you'll be marked right or wrong at a certain point, it will help you to know how to do the right thing. Please note that marking a care plan or understanding care plan is quite subjective. Depends on who is teaching you and how you understand it. But I always tell students that if people are telling you different things, look for the rationale for what they are saying, and you should have your own rationale for choosing any of the sides. So if what I'm teaching is different from what you know, and you have reasons why yours is correct and you think it's tangible enough, that's okay. If mine too is different from what you know, but when you compare the reasons, you believe this one is tangible enough, then you take it. So as I'm going to mark, there are things I'll mark wrong, another examiner would mark correct, or I'll mark correct, another examiner would mark wrong. Everybody will have their own reason. That is the most important thing. There should be a reason it was wrong or correct. So you as a student, you should have a reason for writing what you write. There are some things that are outright wrong. That one, you can't do anything about it. Thank you. So let's go and look at it then. Occupation, name of doctor or physician, date of admission, ward name, bed number, religion. A whole diagnosis is left out. This is medical diagnosis. Operation not done. Not done. Now that we don't know the diagnosis, how do we even know the operation is applicable or is just not done? So date of discharge, the acceptable one is not yet. That is more appropriate. Not yet. So here I'll give half a mark. Half over 1 because of this, the absence of this. Now, problem, patient complains of is not there. Patient complains of difficulty in breathing. So that's a correct problem. So you see, when you don't write diagnosis, it's even difficult to identify whether your problem is true or not. We check all these things against each other. So strength, patient is able to take food in bits. This will be marked wrong. This will be a strength for another problem, but for as a strength for breathing difficulty, it is wrong, so you lose that half mark. Severe cough, patient complains of cough, that's correct. The patient coughs, that doesn't hold water at all, is wrong. Patient complains of chest pains, that's a good problem to identify. Patient can practice oral hygiene. It's not a strength for chest pain. So here the person will get 1.5, and this side will get 0. There should be no known allergy. So here you get your full half mark. So here TPR checked on admission, monitored of hourly. That's not how it should be written. So the correct one is, because this is the first one we are marking, I want to write the corrections there. The subsequent ones, you have to guess the correction. The correct one is monitored for hourly, or monitored 2 hourly, depending on patient, or monitored every 15 minutes. So that is 2 hourly within a day. BP, checked on admission. If it was checked once, that's okay, but if it is monitored 4 hourly, that's better. So this is the correct one. Diet, if patient is not on any dietary restriction, it's normal diet, or depending on what dietary problem patient have, you can fluid diet. light diet depending on the dietary restriction, or nil per os if patient is not taking anything by mouth. Fluids, this is wrong. It should be liberal or restricted. Liberal means patient can take in any fluid. Restricted or restricted on IVs or nil per os. Any of them is okay. You can add on IV fluids. That's patient is on only IV fluids, or patient is on nil per os. Intake and output. If patient is on restricted fluid, intake and output is usually monitored. Not done is not part. You can write not monitored, especially for people on liberal fluids, or monitored. That's if patient's intake and output is monitored. Monitored and balanced over 24 hours. That's the correct one. Maintain with both toothbrush and toothpaste. This is correct. But we are usually interested in the number of times, so maintain twice daily or once daily. If you even end it that's okay. Maintain twice daily. Bath, that's okay. Urine testing, not done. If it's true, then that's okay. Body weight checked on admission. If it's true, that's okay. But it's better to write what you had, maybe 65 kg if you find it. So all these things, you get them from patient's folder or sometimes bedside sheets. You combine the two, or if you are using the electronic system, you get it from the computer. So activity ambulance, that's okay. So when we count here, the person didn't get this correct, didn't get this. So 1 2 3 4 were not correct out of 9. So here it had half. So when you add all of them, this is half plus 1.5, which is 2.5 plus another half, which is 3. So this front page, the students got 3 marks out of 6 for the front page. So let's see what the student had here. So date and time was written, that's correct, but no mark is allocated. Let's take note here. Every correct action at this side is 1 mark per problem identified. Here 1 mark, here 1 mark, here 1 mark, here there's no mark. So in all, there should be 4 marks. 1 2 3 4 for one problem. There are another 4 marks for another problem. Another 4 marks for another problem. That's why we get 12 marks for the inside. So here, so the correct diagnostic label should have been dyspnea or ineffective airway clearance related to accumulation of mucus. Sure, it is for problem 1, so it exists. So the nursing diagnosis, you have to come and check if it's for any of the problem. It's irrespective of the problem number, because inside we prioritize. So it's correct for one mark. Sorry. Assist patient in upright position for objectives with outcome criteria. That's wrong. That should have been an order. So order, there's nothing here, there's nothing here. So you see this whole face, this person will get 1. We'll get 1 mark for this line. So second problem, acute pain, chest. That's a good diagnostic label related to severe coughing. Severe coughing is a problem on its own. It is true that cough can cause pain, But this is where controversies can come in. Someone will mark correct, someone will mark wrong. I will give you half for the correct diagnostic label, but you're related to factor, I won't take it. But it's also a problem. So here could have been acute pain related to extreme exertion, the chest. Here there's nothing, here there's nothing, here for the rest. So the whole of inside, this person had one. So here too, this is a full date, a full order. Yes, it's correct. If it's done, ideally you should write the date that it was completed. Not yes, it's correct. Not yet is correct. This one you should write the date. This one you should write the date it was completed. So here you get your full 1 mark. Here order is half, the whole score is half mark. You didn't write anything. You can even just write not applicable to get your full mark, or you can write no other treatment ordered for your full half mark. Well, the person didn't write anything, so it's 0. Investigation 0. If none is ordered, you can write none ordered or not applicable. But usually at the investigation side too, we come and compare it with diagnosis. This person didn't even write diagnosis. Good. So at the back, the person had 1. At the inside to 1. And in front 3. So that is 5/20. That's not good. This together. When you look at the things here, you notice that everything is full, so 1 mark. So patient complains of appetite, correct. Patient can take light soup, it corresponds with appetite, so it's correct. Patient has elevated body temperature, correct. Patient can tolerate tepid sponging. Patient complains of vomiting. Patient can tolerate oral fluid. Patient complains of headache. Patient can cooperate with activities. That's correct. So here is 2, here is 2. No known allergy, that is half. Here, monitored for hourly, there's nothing here. Monitored, maintained, right? This everything is correct. So half. So this person had the full 6 marks in front. Then the inside, risk for imbalanced nutrition, less than body requirements, related to loss of appetite. This is not correct, because it should be risk for imbalanced nutrition into brackets loss of appetite, then related to the cause of the loss of appetite. Let's look at the medical diagnosis. We can get some malaria. So related to altered physiology, something, just say something that makes sense. So this should be another problem. Hyperthermia 39.1, related to disease condition. So this one, the correct one should be related to Plasmodium invasion, because the medical diagnosis is malaria. So this is correct, but it should be 1 problem per box. So here, patient will maintain her normal eating habits. Once you say risk for imbalance, then it means what patient has now is not good enough. That's why it's putting patient at a risk for the imbalance. So you can't use will maintain. No. Within an hour, as risk diagnosis, we don't give 1 hour. The patient doesn't have the problem yet, but we are saying that the patient can develop the problem. So you give by the end of admission or at the time of discharge, patient won't develop this one. So this, the correct one would have been patient will have a balanced nutritional status at the end of this, at the time of discharge. Then, as evidenced by patient having an improved weight of about plus 5 kilos, and patient having a good skin tegel or something. So this one is wrong. Self food warm, give patient her best meal, reassure patient. This and this can be marked as 1 point. And reassure patient, you don't write reassure patient for everything. If balanced nutrition, you don't need reassurance. So this we could have written weigh patient on a daily scale, serve patient meals attractively in bit, give patient regular fluids, and serve prescribed medication for imbalanced nutrition, loss of appetite. Because we are tackling imbalanced nutrition, also using loss of appetite to counteract it. So this is 0. Here it's not written yet, so I can't give marks there. So here, didn't they diagnose the problem at all? From some schools of thought, if you get the whole diagnosis wrong, everything here should be wrong. Because if you don't know what is wrong with patient, you can't solve it. From other schools of thought, even if this is not there, but what is here and here speaks to a problem identified, then it should be marked correct. So you see, nothing is here, but I say patient's fever will be reduced. So it means that this person is talking about the temperature. So I think this diagnosis was supposed to be for this. So this is for the temperature within 1 hour, as evidenced by rechecking the recording normal temperature of patient and patient verbalize. The outcome criteria is not too good, but it makes sense. So I give 1. Self food sponge patient, I'll give half for the sponging aspect. Self food doesn't work here. Altered fluid related to vomiting. There's no diagnosis that is like this. Altered fluid at where? Patient fluid volume will be maintained. We can mark this. So you see, this person will get 1 half, 1, 2, 2.5, 3. So 3/12 on the inside here. Then let's see the back. Tap P more. It's not TAP, it should be TAB. On tablets to be better. 1 gram TDS times size. That should be correct. Tab. So this is correct, but this is wrong. Folic acid. Date completed. That's okay. But you see, looking at this, you can see that the care plan was done on 24th May 2010, but he said the thing will be completed on 26th. So you write not yet. You only write date when it has already been completed. So here I can go full marks. IV fluids too is accepted as other treatment. So half, that's a full mark. WBC, no unit was given here, but at least students made an effort. So if there's no MPC, how can the patient be diagnosed of malaria at the frontier? So here I'll give full mark, which is half, and the top here it means the person is going to get 2. So in all, this person had 5 plus 6, which is 11/20, which is is very good. Yeah.